So much, Mr. Sandhu, for being here with us. What do you think are the top diseases that Indian audiences suffer from?
See, if we stratify the diseases by age group, we have, starting from childhood, the diseases which we encounter are mainly congenital heart diseases. That is, that they are present from birth. And as we go into the adolescent age, rheumatic heart disease comes up in a big manner in both boys and girls, which may present in the adolescence age group itself or may come up later on in age. And as we go into adulthood, young adulthood, usually they are free from heart disease. But lately, because of the rapid urbanization and adoption of Western style of living with working hours which are not consistent with the normal, younger people are also developing heart diseases at an earlier age. And this also includes heart diseases of the ischemic heart disease, that is commonly called as the heart attacks, which leads to heart attacks. We see it commonly now in younger age groups at around 25, 29 also. And then later on in middle age, people start getting hypertension and its attendant complications, and ischemic heart disease starts rearing its head at about that time. Women are more or less protected till they are in their active life, till they are menstruating. Maybe post-menopausally, they also catch up with men in the incidence of heart disease. So looking at this whole spectrum, if you see in numbers, ischemic heart disease is the number one, which is the disease which causes blockages in your arteries and leads to heart attacks. And this is the one which we target commonly. The pediatric cardiology friends target the children and for the congenital heart diseases and the rheumatic heart diseases. If you talk about screening for these heart diseases, we are looking at simple tests like an echocardiogram, which can detect most of the congenital heart diseases as well as rheumatic heart diseases, and in lots of cases ischemic heart disease too. That is, if a person has already had a heart attack, it can be evident on his resting echocardiogram and an ECG. So simple tests like an electrocardiogram, a chest x-ray and an echocardiogram is enough to diagnose most of these conditions. Silent ischemic heart disease, that is, which has not yet manifested itself, can be detected by stress tests, like treadmill exercise test or a stress thallium test. Or we can also do nowadays a CT coronary angio, which is a CT scan in which the arteries of the heart are reconstructed and we can get to know whether there are any blockages or not. That test is specifically has a very good negative predictive value. That means if it is not normal, it is normal and we don't need to act on it. But it is slightly inaccurate when it does show blockages. Then we need to do a conventional angiogram to confirm whether they are there or not. Then we have a host of other tests which tell us the overall risk of getting a heart disease, like checking your sugar levels, checking your lipid profile levels, and checking your other parameters like body weight, and your taking history of your bad habits like smoking. So all these play a combined factor into overall risk assessment of a cardiac patient. So we factor in all these other tests also in the risk assessment for heart disease. And then we have other tests which are markers of inflammation, which have been shown to predict that you might likely to have a cardiac event in the near future. That is like high sensitivity C-reactive protein, and even the certain subsets of lipid abnormalities like lipoprotein A and small dense LDL. Though of course the significance of that, once we detect them, what to do and act on them, we are not yet clear on that. So at Artemis we have packages tailored for detecting various heart diseases, and if you have had a heart operation or a surgery or an angioplasty, a separate kind of packages targeted for that. We also have other specialties packages for cancer screening and women's health and neonatal health, etc. And I think now all these packages will be available online at healthians.com, where you can log in and see and then access these packages. Thank you.